Do you or someone you know struggle with alcohol addiction? Understanding it is the first step towards recovery. Alcohol addiction is a complex disease that affects both the individual and those around them. It's not simply about an insatiable desire for alcohol, but a physical and mental dependency that can have far-reaching consequences. From health problems to strained relationships, the impacts of alcohol addiction can be devastating. Many people grappling with this disease don't recognize or acknowledge their problem, making it even harder for them to seek help. But the reality is, alcohol addiction is not a sign of weakness or a lack of willpower. It's a chronic disease that requires professional help. Understanding this is crucial. Recognizing the problem is the first step, but what comes after that? Let's dive into the 3 main steps of the alcohol addiction treatment program. The first step in an alcohol addiction treatment program is intervention. This is a vital stage, often misunderstood. Yet it's the foundation upon which the entire recovery process is built. Acknowledging the problem is half the battle won, and this is where intervention comes in. It's a structured process, a caring dialogue, not a confrontation, where loved ones communicate their concerns about the individual's harmful drinking habits. Family members, friends, or co-workers come together to help the person see the adverse effects of their alcohol abuse on their health, work, and relationships. This collective effort, rooted in compassion and understanding, nudges the person towards the realization that they indeed have a problem with alcohol. Remember, intervention should not be an ambush, but a bridge, a lifeline extended to the person, leading them to accept their situation. Only then can they progress to the next step of treatment. Intervention is a crucial first step, but it's only the beginning. The next step is detoxification. After acknowledging the problem, the next step is detoxification. Detoxification is the body's way of ridding itself of the alcohol and can take anywhere from 4 to 7 days. The duration often varies depending on the degree of alcohol consumption. It's crucial to understand that this process can manifest in a range of withdrawal symptoms. These can range from mild discomfort to severe, even life-threatening conditions. Symptoms may include anxiety, tremors, hallucinations, and in extreme cases, seizures. They typically commence within 12 hours of the last drink and peak within 2 to 3 days. This is why it's absolutely vital to undergo detoxification in a medically supervised environment. In such a setting, medical professionals can monitor the person's condition, providing the necessary care and treatment to manage these withdrawal symptoms effectively. Medications may be used to alleviate the discomfort and potential dangers of withdrawal, ensuring a safer and more comfortable detox process. It's also worth noting that existing medical conditions can exacerbate withdrawal symptoms. Conditions like liver disease or blood clotting disorders can intensify the withdrawal experience, making medical supervision even more essential. Detoxification is a challenging but necessary step. It's the body's way of resetting, of clearing the slate to pave the way for the next phase of treatment. However, the journey doesn't end there. The final step is rehabilitation. The final step in the alcohol addiction treatment program is rehabilitation. This is the phase where the real work begins. The goal of rehabilitation is not just to stop drinking, but to learn the skills necessary to maintain sobriety and live a healthier, happier life. This may involve a combination of individual therapy, group counseling, and support groups, each playing a vital role in the recovery process. Individual therapy provides a safe space for those in recovery to explore and understand the root causes of their addiction. It's a time to confront any underlying issues, whether they're related to trauma, stress, or mental health disorders. The goal is to develop healthier coping mechanisms that aren't reliant on alcohol. Meanwhile, group counseling introduces a sense of community, reminding individuals that they are not alone in their struggles. It provides an opportunity to learn from others who are also navigating the ups and downs of recovery. Sharing personal experiences, insights, and challenges can be incredibly empowering and therapeutic. Support groups like Alcoholics Anonymous offer ongoing assistance even after the initial rehabilitation process. They provide a platform to share victories, setbacks, and everyday experiences with those who truly understand the journey of recovery. Rehabilitation doesn't end when the program does. It's an ongoing journey of self-discovery and growth. It requires commitment, patience, and resilience. It's about learning to live life without alcohol, one day at a time. Rehabilitation is a lifelong journey, but with the right support and treatment, recovery is possible. Dealing with alcohol addiction is a challenging journey, but understanding the process can make it less daunting. We've highlighted 3 essential steps on this path to recovery. Firstly, intervention, where the problem is recognized and acknowledged. Secondly, detoxification, a medically supervised process of safely withdrawing from alcohol. Lastly, rehabilitation, where ongoing support and counseling help to maintain sobriety. Remember, recovery is a journey, not a destination. With the right support and treatment, you or your loved one can overcome alcohol addiction.